Doctor, can we start?
Yes, please.
Good morning, Doctor. My name is Ibrahim Afra. We are from Group 1D, and the rest of the members are Ashwini, Abdul Rahman, and Satwinder.
Today, you're on your video?
Actually, I don't have a webcam.
So you don't have a webcam, poor thing.
Yeah.
Yeah. Anyone who presents, please on their webcam, if you have, thanks.
Okay. Yeah. Today we'll be presenting about the etiology, clinical features, prevention, and management of lung barotrauma. Next slide. So, what is lung barotrauma? Lung barotrauma is the physical damage to lungs caused by a pressure change. Pressure differences causes fluids and gases inside the body to expand or compress, leading to injury of the organ. And the Boyle's law describes how pressure of a gas increases as the volume of the container decreases. And the Boyle's law equation is P1 V1 is equal to P2 V2. Next slide. Diving is the most common cause for lung barotrauma. Atmospheric pressure and water pressure acts on the diver under the water. And as the diver descends, it will increase the pressure depending on the depth. As you can see, as depth increases, pressure also increases. When it is 0 meter, pressure is 1 bar, and 10 meter is 2 bar, and 20 meter is 3 bar. And when diver descent, it causes compression, and as the diver ascend, it causes expansion, and also it can lead to the burst of the lung. For example, when a diver breathes a gas when he is under the water, like in the deep inside the water, and if he holds the breath and then as he ascends, the gases will expand and it can cause to injury. Next slide. Another cause is a ventilator-induced barotrauma. Mechanical ventilation used to assist or replace breathing, but when the ventilator malfunctions, like for example, when there is a rapid change in gas velocity, it can lead to barotrauma. And another cause is a blast-induced barotrauma. Explosive blast creates a pressure wave, and also uncontrolled decompression is an unplanned drop in the pressure of a sealed system such as aircraft cabin or hyperbaric chamber. These differences in the pressure can cause injuries to the lung. Next slide. I will pass to my colleague Abdul Rahman.
Okay, thank you, Ibrahim. So for clinical features, we have, for example, lung tissue damage. So this is tearing in the lung, bursting when the lung is over-distended. Some clinical features include shortness of breath, pain when breathing, coughing, which includes dry or with blood. And actually this feature, the lung tissue damage alone has no specific first aid treatment. So the diver should be examined and treated for other cases of lung damage. Okay, next. So next slide is mediastinal emphysema or surgical emphysema. This is gas in the tissue. So this is tearing of the alveoli, which allows gas to escape into the tissues of the lung, where air tracks along the lung tissue to the mediastinum in the midline. Air migrates into the neck, or in severe cases, it tracks around the heart sac, or sometimes it into the abdominal cavity. So some clinical features include chest pain, shortness of breath, voice changes, swallowing difficulty. So in this specific case, it might take some time for the symptoms to develop because the air migrates very slowly through the tissues. Okay, next is pneumothorax. So this is gas in the chest cavity. It occurs when air leaks. So a rupture near the surface of the lung into the space between the lung and the chest wall. This air pushes on the outside of your lung and makes it collapse. So some clinical symptoms might include chest pain, shortness of breath, increase of heart rate, and in this specific case, it requires urgent medical attention. In some cases, minor pneumothorax, for example, less than 25% lung collapse, might be treated by breathing 100% oxygen. Okay, next. Next is air embolism or gas bubbles in the blood. So air bubbles enter the arterial circulation due to tears in alveoli walls, causes damage to blood vessels or obstructions. And you will feel loss of consciousness, loss of function in vision, speech, movement, disturbances of balance or coordination, disturbances of intellectual function, and in this case, it causes hypoxic damage by obstructing important blood vessels with air bubbles. Okay, now we pass to Ashwini for the next part.
Hello everyone, good morning. Okay, then I'll be presenting about the case study. Okay, this case study is about a Navy diver, which is from February 18, and he actually experienced mild tightness and also heaviness of chest, and which got actually leveled up to the neck. And then when he rested, he felt better and went for another diving session, and it got even worsened after the next diving. So he felt tightness in the neck again, and then in muscles, and also throat pain. And he also had swallowing difficulties, which is also mentioned here as dysphagia, and also he had pain in the ears, mainly in his left ear, which is mentioned as left otolja. So these are the pictures. Then for the next slide, he actually got a medical test after the 2 days of all the discomfort, and he had resolved the ear pain and also the chest discomfortness. But then he also had the throat pain and also a mild dysphagia, which is a mild swallowing difficulties, and there's no change in his voice being found. So he went for the examination, and it is found that his eardrum is in normal, and then he had some swellings in the neck, collarbones, and then and also a slight mediastinal hyporesonance, which is the reduced sound of breath sounds, and there's no any neurological signs or symptoms found on him. So these are the clinical diagnosis which is been done, which is a clinical evaluation where the doctor, these are the diagnoses that should be done on the Navy diver, which is the doctor should be able to detect the localized airway obstruction by listening to the sound made in the chest. And then it should be also found that he has any past respiratory function test aids. Then the patient should require to go to a neurological examination, and then a chest X-ray is done, and also a CT scan. And the patient should also measures the ventilation, the movement of air into and out of the lungs using a spirometer. So this is the spirogram and the spirometers that should be used. And then for the prevention and management, it should be proper ascent timing and techniques. You should know the proper timing and techniques for the diving, and then also use a special diving suit like atmospheric diving system ADS suit, mask secondary air source, and also never hold your breath underwater, and equalizing the lungs, such as like holding breath during free diving to maintain volume, and also exhaling air taken at depth to compensate for expansion, and also proper training, mainly proper training and understanding the risk, which is like monitoring air supply to avoid low or out of air situations, and also dive with experienced person who can assist in emergency situations. And also medical fitness, like you have to ensure to be fit to dive and get diving fitness exam from qualified physician. And prevention and management, definitely you have to go you have to care when being in a pressure changing environment like airplane or pressure control room. Then the first aid, where example like basic life support, oxygenation, assessment of airways, and emergency treatments, and also medications to be taken.
All right. Okay. Thank you. Thank you very much for the interesting presentation. So can you look at the title again? Sorry. Can you go back to the title? All right. Basically, you're talking about lung barotrauma. So lung barotrauma is basically a kind of diseases due to pressure. Okay. So the idea is you have basically presented a certain condition where you can get lung barotrauma. One of the condition is basically you focus on diving. The other one you look at ventilator-induced lung barotrauma, and another one is you look at traumatically induced lung barotrauma due to change in pressure when you're talking about explosion. Is it correct?
Yes, sir.
So what other problem that are related to since you have read the some of it, what other problem that's related to diving that you know? What other medical problem that's related to diving or that you know?
Asthma.
No, not asthma. Asthma is basically a disease that when people got asthma, they will need to be screened before they dive. I mean, what medical condition, what issues, medical issues that is related to diving that you know? Have you read? You have read, correct? You have read something that you should have at least know what are the medical conditions related to diving. Any one of you is a diver here? In this group, in the among all the students, any one of you actually have do a scuba diving?
Yes, doctor.
Ibrahim, is it?
Yeah.
Okay, so Ibrahim, tell me, since you do scuba, correct? You have scuba license.
Yes, doctor.
Okay, so you do scuba license. You know what are the problem with diving, correct? What are the illnesses you related to diving?
When you hold the breath under the water, like you will have a lung trauma, and also like when you go down, like when you descend, and if you do not equalize your ears, your ear will rupture.
So those are all barotrauma, lah, correct? So
Yeah.
barotrauma, that is basically barotrauma is pressure, trauma is injury. So injury due to pressure. So injury due to pressure can be the lungs, can be the ears, can be the nose, can be the what we call the sinuses. So can even be the abdomen. Can even it can happen even if you have a caries in your teeth that is not filled in properly. So you can have barotrauma. Barotrauma is basically what it means is just trauma due to pressure. It's called barotrauma. So what are the other basically illnesses that you can see when you go diving, Ibrahim? Beside barotrauma, what you mentioned, all the things that you mentioned basically is barotrauma. All right, barotrauma is pressure, is injury due to what we call traumatic pressure. So traumatic event due to pressure.
I think dehydration is one of the.
Sorry?
Dehydration, like when we go diving.
Okay, all right. The answer I want to get from you all is basically decompression sickness. All right, decompression sickness is basically, when you're talking about this, is we talking about Boyle's law. The decompression sickness is basically due to Henry's law. All right, where basically the nitrogen inside your blood, basically when you dive deep down, nitrogen basically dissolve in the blood. All right, when suddenly you go up and go to the atmosphere, there's sudden change of pressure, nitrogen will basically bubbles up into your blood vessel. So when bubbles forms inside your blood vessel, you get decompression sickness. All right, so decompression sickness is another problem that you will encounter if you go diving. So the decompression sickness is much more what we call that, dangerous than compared to barotrauma. Barotrauma is not so dangerous, although barotrauma can cause sudden death, but decompression sickness also can cause sudden death if you don't manage it properly. Okay, so where else can you find diving? Where else can you see? Basically, barotrauma is mostly related to sudden ascent and descent, as mentioned earlier. But decompression sickness, basically you can also find in what other occupation are related to diving? Where else can you find diving? Who are workers who dive? What are the workers who dive? Diving is basically for recreation. It's scuba. So what other divers actually dive?
Maybe those in the oil and gas sectors.
All right. So oil and gas sector, they do diving. Basically, they dive to maintain the equipment, maintain the structure. So they do diving. Other than that,
those who are working in the aquarium
Sorry?
sector.
Aquarium,
Underwater
okay.
welders.
Underwater welders, yes, correct. Underwater welders, they do dive, the same thing. Aquarium workers, they're diving, they're not more than 10 meters, correct? So there shouldn't be a problem. Okay. And other than that, other than underwater welders, that's what underwater welders basically are more focused on oil and gas lah. Most of the time it's oil and gas. Other than that, where else can you find diving?
Marine archaeologist.
Marine, okay. Marine archaeologist, okay. So in what we call army, also they have their own divers. So there are a lot of people diving for work, all right, of course for recreation. Other than diving, you can also find people actually do dry diving, especially when you talk about barotrauma in what you call that, in a baro chamber. Just now you're talking about hyperbaric chamber, remember? So some people, some of the medical officers actually work in hyperbaric chamber, especially to take care of patient who is barotrauma what we call decompression sickness. So they actually work in barotrauma. And then the other kind of diving, dry diving, is basically people working in doing what we call the boring. When you bore hole, especially let's say your MRT, they're boring the big hole. So there are basically a lot of what we call cutting equipment in front, where you need to change the cutting head, and that is basically is also a pressurized area. So when you go into a pressurized area like this, you consider yourself to be diving. So those are called dry diving. That means dry diving, that means there's no water. It's called diving also. All right, thank you very much. Very good presentation. Can we have the next presentation?